Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Alen Voskanian. He's a palliative care physician, and we're going to talk about his KevinMD article, A Physician in Denial After Being Diagnosed with COVID-19. Alen, welcome to the show.
Hi, thank you so much for inviting me.
We'll get into the article in a little bit, but first off, briefly share your story and journey to where you are today.
Sure, I came to United States when I was 19 as a refugee on my own, and I don't have a lot of people in healthcare in my family, so I went to a community college in Los Angeles and then transferred to Berkeley and was able to get into UC Irvine Medical School and did my primary care residency at UCLA. And then after that, I did a fellowship in HIV and AIDS. That was early 2000s. I saw a lot of HIV patients die in hospice setting and realized that there was a huge need for HIV patients, but also all patients at the end of life. So decided to become board certified in hospice and palliative care. What always drives me and motivates me in healthcare is helping people who are underserved. So initially it was HIV positive patients, and then I made a career pivot focused on palliative care. And slowly I started taking on more leadership roles. So currently I serve as a medical director for a large multi-specialty medical group. Currently, about 4 days a week, I am administrative. So I oversee kind of running of a medical group, but 1 day a week I see patients. Actually, my clinical work is focused on identifying and treating anal precancerous cells. I do high resolution anoscopy and I have an anal dysplasia clinic. So that's what I'm really focused on right now clinically.
All right, and how did you get interested in that field?
When I was serving patients with HIV, the rates of anal cancer were going up, and I had a couple of patients that were diagnosed with anal cancer. So naturally, I started kind of questioning if there are ways to prevent that. And I realized that folks at UCSF were already doing anal pap smears or anal cytology, got interested in getting trained, got training at UCLA and UCSF for this procedure. Again, it goes back to my passion for kind of being attracted to areas of healthcare that patients are underserved. And I realized that anal cancer screening was one of those areas. Patients were ashamed to talk about it. There was a huge need, and it was something that other doctors were not interested in addressing. So that's kind of my journey to anal dysplasia.
Now, from a patient standpoint, what kind of risk factors or symptoms might they have to ask their doctors to be screened for anal cancer?
Yeah, that's a really good question. Immune suppression is a big risk factor. So it comes in the form of HIV or AIDS, having low CD4 cell counts, but also being on kind of immune suppressive medications. For example, transplant, being exposed to HPV, especially the high risk HPV, puts people at risk. And age is another risk factor. Smoking is another risk factor. So those are the main risk factors we look when we think who is going to be at higher risk for developing anal cancer.
So I'm a primary care physician. What kind of symptoms do patients typically present with in my exam room that would make me think, hey, this might be anal cancer?
Yeah, I think the biggest thing that as a primary care doctor, I recommend people to not think that everything is hemorrhoids. I think it's the cases of actual anal cancer that I see is that patients who've been having anal bleeding, their doctor has assumed it's hemorrhoid, and they've been just telling their doctor that, hey, this is not going away. It's months and months and years. Hemorrhoids, as we know, they come and go, they get better. Sometimes they're painful, sometimes they're not. They're associated with constipation. But if a patient says that they've been having bleeding that doesn't go away for a long time, or they're having pain, that should be a red flag. And then also the risk factor. If it's for example, MSM men who are sexually active with men, or immune suppressed patients, I think those should be less worrisome about anal cancer, but anal precancer, like anal dysplasia, and figuring out if they would benefit from getting an anal cytology.
All right, let's shift gears here and talk about your KevinMD article. It was written back in
Yeah.
December. It's titled "A Physician in Denial After Being Diagnosed with COVID-19." Now, tell us, how did this article come about?
Yeah, I thought I was immune to COVID. I got vaccinated, and initially, obviously, like everybody else, I was extremely careful. I have three young children, so we were always putting on masks, always protected. So almost 3 years passed. We traveled, we started going out, didn't get COVID. And I was like, oh, maybe there's something that is protecting me. And right when I started letting my guard down and started traveling, went to a medical conference, and I got off the plane. I got on a taxi. It was in San Francisco. And right before I was getting on the taxi, I heard the taxi driver cough. I had that one moment of thinking maybe I shouldn't get in this taxi, but I felt that would be rude. So I got in. The driver coughed the whole time. And I'm not sure if that was the person who gave me COVID, but after I got back from the conference 2 days later, I got COVID. I think I was in total denial in terms of thinking that I was immune. And even when I was having symptoms, I'm like, this is just a cold, probably. But the test was positive right away. Like, I've been tested over the last couple of years. It never tested positive. But this one, like, as soon as I tested it, within a few seconds, it turned positive. I was like, oh, here we go.
So, what went through your mind when you tested positive? You mentioned that you did all the precautions, you masked, vaccines, and whatnot. So, when you first got that positive test, tell us what was going through your mind.
First, I started questioning. I'm like, how did I get it? What was it? And there's so many variables. I was in an airplane, obviously the taxi driver, but a medical conference. And so first I was questioning. And then second, I started thinking, like, how will this play out? Like, I had patients 2 days from there. I was also supposed to travel the following day. So first I was just worried about the kind of going to this conference. I wasn't feeling as sick yet. I was just having some runny nose, and maybe I can travel. Maybe I, like, all of those things were going through my head.
Yeah.
But then I realized that I just need to cancel my clinic, need to cancel my travel plan. So that's what I was really focused on initially. And because I was feeling okay, I wasn't too worried about it. I was like, I'm going to get over it. It's just going to be like a cold, but let me take care of everything that I need to take care of.
Now, has this episode of you getting sick with COVID, has that changed your mindset about prevention and preventative habits going forward?
Yeah, I feel like it's a balance between how much do we let our guard down going out, like during the holidays? Do we go out? Do we celebrate the holidays? It's been such a long time of not being able to bring teams together and celebrate. And I really miss that. I think a lot of people are missing that social connection. In some ways, COVID impacted me significantly. My symptoms got worse. I got really sick from it, and the fatigue took a long time to get over. So I don't want to get it again. But it did give me a little bit of sense of security that, okay, I just got it and I just got over it. So I felt a little bit of a relief. I'm like, okay, I can go into the holiday season knowing that I just got it. I have a little bit of a natural immunity to get me through it. But as that natural immunity goes down, I'm definitely don't want to get it again at all. It's just, uh, it wasn't like a cold. It was much more severe. So I was like, how come it's so much more kind of painful to go through this than a cold? So I think it's a serious virus, and it's some people say, oh, well, for me it was something simple. For me it wasn't, and I don't want to get it again.
Now, did you try Paxlovid or some of the therapeutics after you were diagnosed with it?
That's why I wrote this article, because as a physician, and I'm really focused on wellness, and as a physician, I guess I'm not proud of the way I dealt with COVID. I was like, I'm just going to get over it myself. I didn't want to bother my primary care physician. So I didn't really reach out. I was struggling, and a colleague called me and how horribly I was feeling, and I was short of breath when we were talking on the phone. And it's like, you have to call someone and take care of yourself. And I didn't want to, making an appointment is not an easy thing. We know, like, access is a big problem and everywhere in healthcare system. I was like, I'm just going to deal with it on my own. And I think that was my motivation for writing this article, because I wish I had just been a better patient and called my doctor and gotten care. I think I would have recovered faster, but it took my friend to say, I'm going to call our other friend, infectious disease doctor, to call you, and you need to get on Paxlovid. I needed that push. My symptoms started getting better when I got on Paxlovid. So if I had to do it again, I would just go be a better patient.
So how long did you have symptoms from this episode?
As soon as I got on Paxlovid, a lot of my headache, my shortness of breath started getting better. The fatigue lasted for a long time. I would say a good month.
Are you still feeling fatigued? Are you still feeling the effects?
I think I do feel fatigue, but it's my baseline fatigue. I wake up very early, so I'm back to my normal baseline level of fatigue. But that fatigue that I was feeling from COVID required me to go to sleep like much earlier than I usually do. Like around 6:37, I was like, I'm done. Like I need to go to sleep.
Earlier on, you talked about that balance between public health safety, like masking, versus that social connection. And that's really the crux of the issue, right? Different people have different values in terms of how much value they place in public health and how much value they place on the other end of the spectrum with that social connection. Now, you briefly talked about some of the questions that you asked yourself in terms of determining where you stand in that spectrum. Now, for those people who are listening, just take us a little bit deeper into your thought process in terms of how can one navigate that going forward, in terms of how much protection they should continue to have and continue to maintain versus going out, going on vacations and having that social connection, perhaps sometimes in unmasked settings. So how does one navigate that?
Yeah, it's very complex. I think some of it is individual decision, but some of it is looking at the trends of the positivity where we are. And like as trends change, as the rate of positivity goes up, I think increasing those measures that are going to protect us, protect the public. Having 3 kids who go to school, no one is wearing masks we're in a public school kind of district. And so my kids also are very social. They engage in a lot of physical activity with other people. I realized that the separation and isolation, the toll that was taking on my kids was significant. So I wanted them to start engaging in some of their physical activities, to go out as much as possible. We're trying to protect them. And I'm hoping that, for me, public health is that if my kids have any cold symptoms or any symptoms, they're not going to be going to school. They're not going to be putting other people at risk. And I'm hoping other people would do the same.
We're talking to Alen Voskanian. He is a palliative care physician, and his KevinMD article is titled "A Physician in Denial After Being Diagnosed with COVID-19." Alen, so for those people who are listening to this and read about your story, what kind of messages do you want them to come away with?
I think the takeaway is that as a physician, I'm sometimes not the best patient. And I guess my takeaway was that seek out and get help if you are experiencing symptoms, and instead of just thinking that it's going to get better if it's COVID. But there's a lot of other things. I've been really focused on physician wellness and burnout, and did a lot of research. And I experienced burnout before, and I know that there's so much stigma for physicians seeking care, if it's medical care, but it's also if it's care for a psychological well-being. And I think that's unfortunate. And I understand there's a lot of history and many valid reasons why there is that fear to seek out and get care. But I guess my takeaway message is that we are human beings, even though we're physicians, and there are times we're going to need care, and to reach out and get care. And kind of my passion for well-being of physicians comes from my desire for patients to get the best care. And for patients to get the best care, they need to have physicians who feel well, who are not burnt out. And that's the reason why I was motivated to write a book about my own experience about burnout and finding wellness, and experience of other colleagues and physicians who kind of went through that journey of burnout and found a way to have joy in practicing medicine.
And what's the title of your book, and where can readers and listeners find it?
The title of my book is Reclaiming the Joy of Medicine, Finding Purpose, Fulfillment, and Happiness in Today's Medical Industry. And they can find it anywhere they buy their books, Amazon, Barnes and Noble, just it's published on any kind of standard booksellers.
All right. Thank you so much for joining me and for sharing your story.
Thank you so much, Kevin, for having me on.